This segment will focus on the constitutional authority for public health. My name is Beth Meyerson. I am faculty at Indiana University School of Public Health in Bloomington and the co-director for the Rural Center for AIDS and STD Prevention. It may help first to reflect on the myriad words associated with public policy. Sometimes words such as regulations are used interchangeably or differently, so know the meanings and understand the context of their use. Let's give some examples here. Law, then, something developed, vetted, and passed in the policy process located in the legislative branch, state or federal, and signed by the executive, president or governor. In the case of the U.S., an example is the Patient Protection and Affordable Care Act, or the ACA, as it is known now. Rules then extend, of course. Let's use the example of the Affordable Care Act, or ACA. It could be something such as the administrative rule issued by the administration, the current Obama administration, to identify the minimum standards of all health insurance plans sold in the U.S. Here, rules are written with reference and grounded in the authority of the law. Let's dig a little deeper here into this example. The Centers for Medicare and Medicaid Services, or CMS, published key provisions, regulations, that prevent insurance companies from discriminating against pre-existing conditions. So here, rules and regulations help dictate how laws are to be implemented. So according to the Institute of Medicine, public health is our collective responsibility to assure the conditions in which people can be healthy. Now that assurance and that collectivity is expressed through our democratic process here in the United States. It's part of our collective governmental response, if you will. Our collectivity then is expressed in essence through governmental means. Yes, public health is intersectoral. We have to recognize that, and through the many avenues, public, private, nonprofit, various societal sectors, we work together to achieve healthy communities. But there's also a governmental duty. That is our collective duty expressed through our collective governance. Now, this authority answers, if you will, when we think of constitutional authority for public health, right? This collectivity, this assurance. The authority answers the says who question about health. So, for example, smoke-free workplaces? Well, says who and on what authority? The authority rests in our assignment of powers to our governments through the Constitution. So when we think about the Constitution and our authority for public health, just know that our public health authority rests in this document, the Constitution. It defines the duty that we have, the authority we have, and the limits of that authority. Okay? What governments must do or don't, what we shouldn't do. It expresses what we believe to be our duty. The authority then is what government is empowered to do, but not obligated to do. And then the limits, if you will, is what government is prohibited from doing. Now this limitation, how it's expressed and how it balances with duty and authority, is culturally ascribed, and it is unique to the places where we live. This country, for example. The U.S. has its own expression or its own unique balance of civil liberty and authority and duty as compared with other countries. This balance is continuously debated, and certainly it evolves or revolves in our policy process. Sometimes the balance, by the way, changes based on the issue itself and our social construction of it, which again is further evidence of the social cultural construction of our authority or balance of powers. Lawrence Gostin, calls this Constitution of ours the fountain and the levee for our public health authority, and we'll talk a little bit more about that in a moment. When we talk about authority and limits for public health power, we are understanding that the Constitution defines this and talks about the authority for this power and the limits of this power, what Gostin would describe as font and levee. Now, our understanding of the role of government in public health is grounded in varied and sometimes conflicting conceptualizations of anti-paternalism, paternalism being the control of individual behavior for one's own good by others, and conceptualizations of public good, which is not necessarily the sum total of all individual goods. Now, it's important to recognize that U.S. and British thinking of individualism and civil liberty is highly influenced by John Stuart Mill's 1869 essay on liberty, whereby he argues that the only justified purpose for government is to protect the liberties of the individual. Now here, the public good is the protection of individual private rights. In contrast, though, to this Millsian view is a communitarian view or strain of thinking, influencing our understanding of government authority for health. This understanding would be expressed by the notion of common good, where public good is welfare of the group through protection from threats and of all kinds, if you will, to the collective welfare. Again, not seen as the sum of individual property rights or individual rights. Note here, again, that these two notions are in conflict, and the balance of which is part and parcel of our political process and evolving debate over time. Now, grounded in this notion of the protection of the common welfare or common good is police power, prensa patriae. Note that this is the power reserved for the states, and states delegate this to their political subdivisions, such as county and municipal governments, to enact measures to preserve and protect the safety, health, and welfare of its citizens. The Constitution actually reserves this power for states and the people, which is why it's not unlimited power, if you will. Now here, it's our constitutional understanding with additional history of case law which define police powers. Now, for public health, this means that health and safety, as needs, if you will, the health and safety of the population, can subordinate the market, private property, individual liberty to protect compelling community interests. Again, that balance of protection of individual rights and liberties, protection of the public good. We will talk a lot about the balance between civil liberty and collective responsibility as we proceed in discussions of health policy and politics, as the balance evolves over time, and I would argue with the social construction of policy problems and individuals. For now, however, just note that the U.S. Constitution in the 10th Amendment reserves this power for the states and the people. It is the central power, or a central power, underlying public health. It is not unlimited, as I noted, but it is extensive, and it is checked only by the Constitution's express protection of basic rights. The state's power to protect the public health is designed to defend the common life and community, and individual liberties and private property, here don't exist in a vacuum, as Beauchamp would argue in our reading for this week, but are in essence functioning in a world that is shared by individual members of the community. So examples here include the earliest 1850 report of the Sanitary Commission to the Massachusetts State Legislature. And this commission argued that individuals must be guaranteed the same sanitary conditions irrespective of where they live, and that this sanitary conditions are under the control of the public authority due to the severity of risk to life and health. So, as explained in our course readings, case law, too, has further defined this power. Other public health examples here would be quarantine, or compulsory vaccination, or even regulation of dumping or air pollution. A common example, or a more recent example that has been in the news as of late, is indoor tobacco use. Now, Larry Gostin's text, Public Health Law, Power, Duty, Restraint, is an excellent resource to understand public health law and its expression. Here, Gostin identifies the 7 tools for consideration. These are public health policy tools, and there are also some strategies as well when we think about that. We're going to unpack this during this segment, and we will talk about this and more about the allocation of powers through the Constitution for public health. The first is our power to tax and spend. Now, our governments, federal, state, and local, we're talking about the United States here, have tax and spending powers with differing allocations and expression. Federal governments may pass a tax increase, whereas local county governments must pass a tax increase through public vote or ballot. Tax here would be understood as an incentive and a disincentive. It raises funds or directs expenditures, if you will, through this power. Tax on sale of, say, hazardous products, tobacco, production of needed vaccination or medication, emissions taxation, tax expenditures, incentives for desired behaviors such as maybe green space. These are all examples of the power to tax and spend. The agencies listed here are examples of organizations and associated efforts that are made possible by the power to tax and spend. These are funded by tax dollars, and their programs are funded by tax dollars, if you will. HIV prevention, for example, is funded by federal and state tax dollars, and programs are funded through federal and state grants. Those are taxes are raised, they are appropriated through bills, they are given to federal agencies. Agencies promulgate grants to states and local communities for these services. Some local areas receive federal grants directly as well. All of this is possible through the power to tax and spend. Now, research, such as that which is funded by the National Institutes of Health, for example, funds a significant amount of public health related research, NIH does, all of which is funded by tax dollars. So again, here's an example of the power to tax and spend, with focus on the fact that through our power to tax and spend, we also can determine how such programs are implemented. Now, in this case, our Supreme Court issued a ruling on the administration's regulation regarding what organizations must do if they receive federal funding. Note a little history here, noted in the article for you to understand just what had been required in the past of recipients of federal tax dollars. So you can pause this lecture to review the example or to seek it out in the January 11th, 2013 issue of the Wall Street Journal. This is also a great example of the balance of powers, as it is a court, judicial branch, determining what is appropriate based on the administration's rule, executive branch. So again, good example of the power to tax and spend. So it's not just about making money, developing money, making it available, if you will, by the power of taxing, but also determining how it will be spent. So not just saying we will put taxes toward this, we will also have the power to determine how those tax resources are used. The next power is the power to alter information environments. Now, take a moment and try to think about what this means and how we might do that in the United States. Look around you and see what might be evidence of such powers. So think about signs and labels. Nutritional labeling, for example, containing facts about the food we eat. This is a tremendous example of not only health policy and the power to alter information environment, but politics, if you will, politics at work around the power to alter the information environment. So think about the debates around food labeling, how food is even defined, what is a food to be labeled, what is required on a label, who must label and follow that regulation or rule, right? Think also about tobacco labeling, not pictured here, and the debate about graphic images on cigarette packs. These are all examples of the governmental power to alter information environment. And again, in the two examples, the political examples of tobacco labeling and food labeling, both examples are in the policy process debated. And the debate is around authority, that balance of civil liberties and duties, the balance of the authority and the limits on that authority. How much can we encroach upon individual cigarette makers to provide information to the public about the safety of that product? This and more will be discussed in this particular course. But think about the fact that this is not, shall I say, a monolithic concept. It is dynamic in so many ways. And in our policy process, the authority balance is debated continuously in our democratic process. The next public health policy tool is the power to alter built environments. Now again, look around and think about examples. We see traffic calming, green space development. What we do and don't do with our powers is important. Note too that we might use one power to help alter another elsewhere. On the right is a photo from my work in Kibera, a slum in Nairobi, Kenya. Here a little boy is showing me his playground, or the area where he plays. And note that anyone seeing this picture would see that he's basically in a trash bin or a dump, if you will. But this is where he could play. It was really the largest unencumbered environment that he had in the slum area. Tax dollars from the United States, think power to tax and spend, were at work at that time, this was in 2002, on water safety, so sewage and cleaning drinking water, clean drinking water. Perhaps now there might be other tax dollars at work to help transform environments for children so that they can have safe play. Again, power to alter built environments. The next is the power to alter socioeconomic environments. Now this one might be right in front of you, but you might be unaware of the benefit. Most students, for example, have benefited from this power. Many of you are likely beneficiaries of this power in the form of government-subsidized student loans. The example on the left is the use of our tax incentives and grants to create greater health access here where people live, in essence. So both the powers of tax and spending and altering socioeconomic environments is at work in this example. If you're fuzzy on why that might be, think about why health is important to economic sustainability for people and communities. If we're sick, for example, we can't work. So in providing health access, we are altering the socioeconomic conditions for communities. Another example of this would be nutrition programs at schools. So think of school breakfasts and lunches for kids who are economically eligible. Reducing the economic burden on these families is one part of that, but also providing nutrition for kids is another, right? A final example would be funding of programs for apprenticing, so apprenticeship programs so that young men and women can enter the workforce in a stronger position for jobs. Now you might say, well, what does that have to do with health policy? That I want you to decide. The next public health policy tool is about direct regulation of persons, professions, or professionals, if you will, and businesses. We interact with evidence of this power and policy tool every day. Think about all the businesses and professions that are regulated by states. Here are pharmacists and tattoo artists, but there are many, many more. Businesses are licensed by the state, for example, to sell health insurance. On the right, the map, is an example of state regulation of indoor air spaces. Every state, and here you see the diversity, has different regulatory determinations about clean indoor air. They regulate indoor smoking differently based on a variety of factors. This regulation of businesses, for example, who provide a service, that would be bar, or restaurant, or meeting place, and a regulation of employers for people in the state. And again, some states don't focus on the employee health component at all, whereas other states do. Recall now that states have the primary authority for public health. We'll talk about that in a moment. But it is the case. It is the way our Constitution is set up. So when we talk about public health authority, it rests primarily in the states. So this example of smoke-free indoor air underscores the fact that in public health, we essentially have the potential for at least 50 different solutions to public health challenges. Now, the last two are indirect regulation through tort system and deregulation. Now, here are policy tools that we'll discuss just on this slide. A tort is any wrongdoing or strange act, if you will. So think about lawsuits for liability, product liability, where people might be hurt using a certain thing. Recall several years ago the lawsuit about hot coffee spilled in a McDonald's restaurant. Now there are warnings that you see on coffee cups and when you're being served coffee. Certainly in this case, there was a court remedy, a remedy in the court system of wrongdoing by that particular company that produced and sold the product. In essence, hot coffee that burned a consumer or a purchaser of the coffee. Now, deregulation, we're talking here about laws as health barriers, right? Here it means essentially the removal of laws or rules which impede public health. Now, in healthcare, there's often talk about deregulation to reduce healthcare costs, and the argument has been made that, well, we would be better healthcare providers if there was less regulation. Another example would be the change in regulation at state level related to pharmacists. Now, right now, pharmacists are given certain authorities in states to do certain things, mostly under the authority of physicians when encroaching on traditionally ascribed physician roles, such as vaccination. There's an emerging movement, for example, to deregulate or even change or expand the role of pharmacists in states to advance public health. And again, states have the primary authority, so it is state statute that must change if that kind of deregulation or perhaps re-regulation occurs. Now that we've discussed the tools, let's review the fact that our Constitution, it allocates power between federal and state governments and among the three branches of government. Now, this point should not be lost when we think about public health authority. This chart from Gostin as well displays the three branches of government and their separate duties. Note that all have equal powers, and this is a balancing, and the balancing of which about which we often debate in our policy process, and we see it in several issues. I gave several examples during this segment, but we can see it in even the Affordable Care Act. What can the administration do? Even as we think about federalism, which we'll talk about in a moment, that is also very present in the current debate around healthcare reform. All of this is about powers and balancing the powers and authority. So this slide also from Gostin, this image, describes now the allocation of powers to the federal government from the states, if you will. This is our reservation of powers to states as federalism, what Gostin calls our sorting device. Now, we often deal with this federalism in health policy, especially as we try to understand how the powers are expressed in particular issues. Let's take a moment to understand federalism and public health roles. So again, federalism is this concept of sorting between federal and government, or local, federal, state, local subdivisions of their powers and authorities. States and local subdivisions have the primary authority for public health. States is the primary government. This sounds so basic, but we often forget it, and that is we are the United States of America. The states here in the U.S. have the primary power. We allocate our power to the federal government. The federal government then has a supporting or assuring role in public health. It's circumscribed role in public health, if you will. We might think this is otherwise, by the way, because of the ubiquity of federal funding for public health. In some states, for example, federal funding is the only source of public health funding, but it is the states that have the power of public health. So we think about an example would be immunization. We allocate federal tax dollars to immunize children against important childhood diseases, and this support includes program funding for state immunization programs themselves in departments of public health, state departments of public health, local departments of public health. So here states, though, determine how children are immunized, what is required, when it is required. So we may hear about school entrance requirements, whereby immunizations are necessary for entrance or enrollment in school or continuation in school. In some cases, parents may opt out to such immunizations, and that is determined at state level. A hot topic related to immunizations would be the HPV vaccine. This is a vaccine for human papillomavirus, various strains of which have been associated with cancers, cervical, oropharyngeal, anal. Vaccinating kids before they become sexually active is recommended at federal level through not only the federal government CDC, but also our USPSTF, U.S. Preventive Services Task Force, etc. But states themselves determine whether and how this is done. So some states, like Indiana, for example, do not require the HPV vaccine, do not include it in the school vaccination requirements, but it does require information to go to parents. And herein lies an example of how this sorting works out for the expression of, in this case, immunization access and policy at state level. So in review, there are three key notions to recall from this segment. The first thing is that the U.S. Constitution is the basis for our public health authority in the United States, and that authority primarily rests in the states themselves. That there are several tools or powers that we rely upon to accomplish the work of public health, and these powers are all around us, and we can see them at work and the debates about them at work all the time. And that finally we sort out our different roles, not only between the federal and state governments through federalism, but also we sort out our powers among the branches of government. So this would be our legislative, judicial, and our executive branches of government through our balancing of powers. So federalism is the sorting out of the different roles between our levels of government, but our branches of government would also be another sorting that happens in the United States. Our course readings and our conversation will expand upon these fully, and my hope is that you will not only begin to see these at work in your worlds, but that you will see ways to improve the way in which our public health authority is understood and expressed, so that health outcomes for communities will be stronger.